Hello, I'm Dr. E. Barry Gordon. There are 4 parts to this video. It's primarily about a disease that I believe exists. If I'm right, this condition leads to a lifetime of comparative personal misery for hundreds of thousands, perhaps even millions of men and women. These afflicted individuals come out of adolescence without the ability to achieve fulfillment in many areas of their lives, simply because they're slightly to moderately deficient in testosterone, a hormone that's basic to all mammals, a hormone that's vital to full physical and mental health. Because of this deficiency, they reach adulthood doomed to plod through life, depressed, anxious, withdrawn, unhappy, lacking relationships, because while it's obvious to all who know them that there's something wrong, no one knows what it is. Following the main presentation are videos made by 2 men who I believe had this disease before they were begun on testosterone replacement. At the end, you'll hear some comments from the grandmother of the second man, the woman who raised him. Hello again. I'm Dr. E. Barry Gordon, and this is the 11th video in my series on testosterone deficiency. This disease is the most serious disease most of us will ever face, other than the one that kills us. And even that illness will likely have been worsened by the lack of testosterone. Yet with all that debilitating and fatal potential, testosterone deficiency is habitually ignored and neglected by almost all doctors. Today I'm going to begin discussing the specific diseases that are caused by or affected by testosterone deficiency. There are a lot of them, and I'll generally be presenting them from those that affect the youngest to the oldest. It's kind of ironic that the first testosterone deficiency disease to discuss, adolescent hypogonadism, really need not be part of these videos because it's a well-known and well-recognized disease. In this condition, extreme testosterone deficiency results in a failure of pre or early teens to enter into their adolescent growth spurt and to physically sexually mature. Their testosterone deficiency is severe, and young people with these very obvious signs and symptoms are readily diagnosed and successfully treated with testosterone replacement. My concerns first begin with those adolescents having what I've recently come to believe is a milder form of testosterone deficiency that is not recognized by the medical community. It is not diagnosed, it is not treated. I call it post-adolescent testosterone deficiency. These young people do manage to produce enough testosterone to grow normally and even to sexually develop. But because of a mild to moderate testosterone deficiency, they enter into adulthood something less than fully mature. They wonder why they're not quite like other men and women their age, why they're not as hot about sex. If a young woman, she doesn't understand why she doesn't have orgasms like her girlfriends, or why she finds them difficult and less than fully satisfying. These young people wonder why they lack self-confidence, why they're chronically depressed or anxious, why they may lack ambition, why they're simply unhappy all the time. Understand that I see testosterone as a major factor in the world of depression and anxiety, even affecting a person's sense of oneself. We will be devoting a future segment to testosterone's psychological effects. These unfortunate young adults are doomed to live something less than vigorous, productive, sexual, happy lives, because while those close to them see that they're not truly thriving, no one knows why. Certainly, no one ever thinks to check their testosterone level, so obviously their deficiency is never discovered and never treated. What evidence led me to believe that this condition even exists? Several things. First of all, it should exist. Why do I say that? Almost all diseases have a broad spectrum of severity, from very mild to devastating, even fatal. If you'll recall, those early or pre-teens with adolescent hypogonadism have severe testosterone deficiency. If some adolescents have severe deficiency, by the nature of biology, many more should have mild to moderate deficiencies. I've had a couple of male patients, one at 51, the other in his 40s, who experienced a significant voice change, a deepening, during the first months of their testosterone replacement. Neither had ever had the sexual interest or pleasure that they were currently enjoying, and it eventually became obvious that they were actually finally completing puberty. Another male patient, age 31, had lived a life with minimal interest in sex and a profound lack of self-confidence, even to the point of maybe seeming to be antisocial. His testosterone level was very low, and replacement not only matured his interest in sex, but also significantly improved his self-confidence and his social life. When it comes to women, I've had many testosterone deficient patients tell me that not only do they not have much libido now, but they never had any real interest in sex, even as a teenager or a very young woman. In this regard, one of the many surprises I've encountered during this past decade was discovering how many women, while being sexually active, have never had an orgasm. I've heard this from quite a few female patients, ages ranging from 25 to over 50. When you ask questions, you learn things. Certainly there can be psychological factors behind an inability to orgasm, abuse as a child, a dominating, neurotic, sex-hating parent. There also can be physical illness or medications that prevent it. But I'm convinced that orgasm difficulties in young women is not only a very common problem, but that in the overwhelming majority of cases, the reason is a combination of clitoral insensitivity and insufficient mental stimulation due to their failure to have ever produced quite enough testosterone. Replacement therapy, by the way, brought all these women a sexuality they had never known before. If you recognize yourself in these descriptions, get your testosterone level checked. Make certain, however, that you get the right test done and that the results are interpreted properly. Very few are. It may not be nice to say, but don't trust your doctor to know. Review video 6, in which I discuss the problems of testosterone testing in detail. Study the testosterone testing section on my website, www.thehiddendisease.com. Testosterone testing is at the bottom of the medical studies page. If you do see yourself as possibly fitting this picture of post-adolescent testosterone deficiency, and don't find out if you have an adequate amount of testosterone, and don't get proper treatment if you're deficient, you may be making the biggest mistake of your life. In my next video, I'll begin the enormous subject of acquired testosterone deficiency. Those conditions arising in people who once had an adequate amount of testosterone, but then, as we all eventually do, began to lose it. And finally, help me inform everyone about the existence and nature of this disease of testosterone deficiency. Email these videos, these links to everyone in your address book and ask them to do the same. And by all means, tell your friends and relatives about them. I'm Dr. E. Barry Gordon. Thank you very much for watching. We have with us today Mr. Anthony Bonavera. I guess that's good truth, right?
Yes.
He is currently 42 years old, been a patient of mine for 7 years, and has been on testosterone replacement a little bit over 2 years. So what was going on with you before we got into testosterone replacement? Well, let's talk about first of all, how did you hear about me?
Through a good friend of mine who was coming to you, who seemed to have been having the same problems as me, and says, Anthony, he says, my life has changed a big way. He says, maybe you should go and speak to him. And I came here.
Well, how was your life at that time?
Very boring, very...
What about the physical part? Your strength, your stamina, your energy levels?
Very low. I was always kind of veering away from doing lots of activities with my friends. I would kind of want to hang out home, not go out. Work-wise, my stamina, I noticed, was extremely low. I just didn't have it to, you know, I just felt winded all the time. Nothing mattered, really.
And psychologically, how were you then?
Very depressed. Never felt like doing much of anything. Just not even work. I always felt like there was a rock on my shoulder.
Just mentioned before about not wanting to go out. Now that's not anything to do with your lack of strength or energy, not wanting to go out with people. Were you reclusive? Were you introverted? Did you just want to stay home by yourself?
I just was, always had a fear of going out. It just didn't feel like doing much of anything with my friends. I was a loner.
How was you a loner?
I was a loner.
How was your sense of confidence and your sense of esteem, self-esteem?
Very low.
In both of those areas?
Yes, very depressed.
So this was all happening at the age of about, when we started treating you, you were 40. And so how far back does this go in your life that you felt this way?
At least 20 years.
At least 20 years. So most of your life you've been feeling
Most of
this
my life,
way.
yep. About 20, 21.
How were you sexually before we started the testosterone?
Married with my wife now, going on 9 years. And for 6.5 of those years, once a month. If that. Sex wasn't a very big thing with me.
Had it ever been a real big thing with you?
When I was younger.
How much younger?
When I was around 18, 19, even 16, something I loved to do sexually, I was great.
And you lost it?
About 20, 21 years old, it just went down the tubes.
And stayed down?
Yep.
And would it be fair to say that at the same age you lost your sexuality is when you lost your self-confidence, you became depressed, you became fatigued easily,
Yes.
all at the same time?
Yes, everything.
So you had been this way before we started testosterone for 20 years?
Yes, very depressed.
Okay, so then we did a testosterone level on you and it was extremely low.
Yes.
Almost undetectable, and you started testosterone replacement in October of 2006. And what happened?
My life just totally changed. In what ways?
Let's start with the physical and the energy and the strength.
Energy. After about the third shot, my strength, I just felt like a light bulb. Not dim anymore, very bright, brilliant. Suddenly nothing bothered me anymore. I was going out and enjoying life. I was talking to people. My thoughts were coming to me and clearly. What do I mean by that? You know, if I could hold conversation, I wouldn't be afraid to talk in a conversation. And my concentration levels were outrageous. And they were never out like that before. They were always very dull and, you know, nothing. I didn't want to say nothing. All of a sudden now I feel energetic. I don't fear going out anymore. I enjoy going out.
Your depression went away?
It went totally away. In fact,
the go ahead, what?
In fact, that if I would miss a shot for more than 3 weeks, I would notice all of that starting to come back to me. And it wasn't something good. You just kind of feel like, wow, I know that I'm wearing off here. There's something not right.
And the self-confidence and self-esteem?
After I started taking the shots,
yeah.
Like I said, around the third time I seen you, everything just started coming up. I felt like everything was blue skies now, sunny skies. I was enjoyful. You know, I could go out, I could do things.
What happened with you sexually from the testosterone?
The life just turned around. I felt like I was 18, 19 again. I was having sex once a month if I was lucky, to having sex probably 3-4 times a week, to when my wife actually slowed me down saying, Anthony, you became a horny dog, and that was just hiding inside me all that time. It just...
Yeah, you can't be horny without enough testosterone. It has to start with that. So it's had a major effect on your life.
A large effect.
What about your work? Has that affected that?
Well, I work for a large refrigeration company, and that means that you have to sometimes use ladders to get into the highest places you can imagine. They stick these units. Before, I would be afraid to put up a 15-foot ladder. You know, a lot of people, they don't want to really talk about fear, but I was afraid to tell my boss I can't do that. And if I would tell that, I could lose my job. Here I am, after the third time seeing you, my fear of heights totally went away. When I was 18, 19, 20, I had no problem. Then all of a sudden, from 21 to present, before I started taking the injections, I was afraid to get off a ladder. I would have had to hang onto the ladder with my two hands, and I would put my leg gently over onto a roof to get up onto the roof, and then I'd walk around like a monkey for like 5-10 minutes, real low, to feel my center of gravity. Now that's all gone. I'm back to working. Don't even think secondly about heights. Sometimes I set the ladder up, and now before tying it off, 3-4 ropes. Now I just set it with one rope for safety like I'm supposed to. Get up onto the roof, and there I am.
All this happened to you, and the entire medical world wants to pretend that this disease doesn't exist. It's amazing. There was something else about your voice and something your mother told you?
Here I am, I'm 42 and a half, and my voice was squeaky all my life. My mom said to me, between the ages of 16 and like 19, my voice started changing, but then it stopped. I kind of just had a mid-high voice. Never thought anything of it, I just act. You know, you don't think that. Here I am now. My mom just about 2 or 3 weeks ago at Thanksgiving said to me, Anthony, your voice changed. Your voice got very deep. And you sound more like a man. I said to myself, this is wild. I says, maybe I've never ever fully got into puberty.
You are absolutely right. You never fully completed puberty. And there are, if not millions of people like you, there are certainly hundreds of thousands. Well, you're one we helped. We'll try to get the message out to help more.
We really need to talk to people about this.
Okay. So thank you very much for making the video.
No problem.
It's been a pleasure.
Likewise.
Okay. This is Mr. Demetrius Beatty. He is 39 years old. He's been a patient of mine for 6 years and has been on testosterone replacement since July of '07. Mr. Beatty really didn't have any complaints referable to testosterone deficiency at the time I first tested him, which was May of 2007. I guess I had a suspicion that he might be testosterone deficient. And indeed, his testosterone level at that time, again at the age of 38, I guess he was, came back extremely low. His testosterone level, his free testosterone level, was so low that if he had 500 or 600% more, it wouldn't be too much. And in July we discussed this finding, and we discussed his life. And why don't you tell us what your life was like at that time before you started the testosterone?
Well, I was introverted, shy, and actually I was kept to myself all day. That's how I felt.
Oh, it's sort of like being antisocial.
Yeah, almost antisocial. Don't want to go out.
Depressed?
Not depressed, but don't want to do anything.
And interest in women?
Well,
Not much.
Not that much.
And how long, this is what's interesting, how long had you been that way?
Well, almost my whole life, almost.
Your whole life, basically. So you had never really had much in the way of, you were never hot about sex, never hot about girls?
No, not really, no.
No. I think that you're one of the people that I described in the video that I called post-adolescent testosterone deficiency, that you probably never ever secreted quite enough testosterone to become fully mentally and sexually mature. And I think there are millions like you, or maybe hundreds of thousands. But anyway, so in July of 2007, we started you on testosterone replacement, and what happened?
I got a little better each day and day. I'm starting to go outside a little bit. Actually talk talk to somebody outside. When the first time I had the shots.
Uh-huh.
And
as they progressed?
as it progressed, I was going out more, hanging out with the fellas now, and going out to movies.
More social?
More social.
And you're interested in women?
Oh, is there.
Much more. Big difference?
Yeah, much more.
Much more.
Much more difference.
I'm looking at the notes that I wrote after we started him on testosterone replacement. Even after one shot, he had told me that he had more energy, he felt more self-confident, and he had more of an interest in sex. And as the shots continued, this steadily increased. And he's really a different, I can see he's a different person. He talks differently, he acts differently, his whole affect is different. So this has made a major change in your life.
Yes, sir.
And it's persisted. You still feel good.
I still feel good.
And you look much better. Well, I'm glad to hear it, and I'm sure that people out there will be interested in this. So, thank you very much.
You're welcome.
Okay. This is Mrs. Edna Kearney. She is 75 years old. She's been a patient for 10 years. Mrs. Kearney has made another video about herself, describing what testosterone replacement has done for her. But today we want to talk about her grandson, who you've just seen, Mr. Demetrius Beatty. So, from your perspective, what was Demetrius like before he received any testosterone replacement?
Well, he was, I would call it introvert. That's someone that was,
Right.
he wouldn't, like if he went to, had a doctor's appointment or whatever, I would usually go with him because I figured he wasn't going to talk up for himself. And now, I don't have to, he'll tell me, Mom, you don't have to talk for me. I can talk for myself. And I see people that he interact with now. He's like me, he's all up in their face, where before he would kind of shy off from people. But now he's outgoing, and he's just a different person.
Different person. I would add that you've raised him.
Yes, I raised him.
You raised him. And he was that introverted person his whole life?
Yes, he was.
Shied away from girls?
Yes.
And now there's a difference in that?
There's a difference, it's a very much difference in that.
So he's really become a different person?
Yes, he has.
Yes, I see it too. Even the way he talks to me.
Yes.
Instead of withdrawing as he talks, he comes forward when he talks.
Yes, that's what he
It's a pleasure to see that change in him, isn't it?
It is. That's the way he do his people he talk to now. His friends he used to, like withdraw from. But now he's in their face. So it's good to see a change in him. And I mean, it's a big change.
Good.
And he seems to have more energy, more get up and go about him. And it's been a big change.
I'm glad we were able to help him and change his life.
Me too. Me too.
Thank you very much.
Okay.